So how does it all work? Hi, I'm Martha with KeithRN, and I co-created this unique and innovative teaching tool alongside Keith. I'm going to give you a quick demo of how everything looks. Students will access this assignment from a link that you send them. Once they land on the assignment, they're going to input some basic information, their name, as well as their instructor's email address. And this is how the instructor receives the completed report at the end of the assignment. First, students are presented with the story. In this case, they need to text an update to the provider, and they need to gather the numbers or uncover the numbers of her phone number. We use Tanner's clinical judgment model to build these escape rooms, so you'll notice hints of that throughout. Here we're starting with the noticing step, and students must identify important information within this triage note, and they have unlimited space here to enter what they consider red flags. Immediately after many of these questions, they are provided with rationale as well as the correct response. There are open-ended questions. There are also codes to uncover. Here, students are in the noticing phase of care and must identify red flags within the assessment and vital signs data. They use these then to create a code that unlocks the next step in the case study. This next puzzle is about lab analysis, and students are presented with a chart. They can click directly onto the chart as well as type in to the box regarding clinical significance. Once they're completed, they will download this to their own computer with their changes and upload it for their instructor to view. There are select all that apply questions. Here is another example of an open-ended question where students describe the pathophysiology of DKA. Here is an example of a closed style question. Students must choose the correct word or phrase from the options listed, and they can type directly into the space. Again, throughout this assignment, students are collecting numbers for a phone number that they will use to text an update at the end. This is an example of a matrix style question. Students will be able to click these boxes, and this exact chart will be sent to the instructor at the end. At this point in the case study, we are in the responding phase of care. And here, students choose from a drop-down menu of expected outcomes and then can free text their rationale. Once completed, they download this with their changes and upload it for their instructor to view. This is a medication calculation question. Here, students are calculating a bolus of fluid as well as an insulin drip. When students provide an incorrect response, they are directed to some supporting rationale. At this point, it does not give them the exact answer, but it does provide them with the ratio that they need to set up, and they can continue to figure out the problem without just being given the answer. In this puzzle, students are evaluating outcomes. They can select an ink color here and draw directly onto this picture. So they are asked to circle findings that indicate that the patient's condition is improving. So they can circle their response and submit this to their instructor. Additional visual puzzles are provided. In this case, students are asked to identify parts of the image that indicate that the patient's condition is improving, as well as safety concerns. And again, they are provided with rationale immediately following each question. This is another example of a matrix style question where they are asked if the data that they have collected 4 hours ago compared to their current finding has been effective or ineffective in improving the patient's condition. Here, students are asked to provide patient education related to a new diagnosis of type 1 diabetes. They type directly into these spaces on the document, download it to their computer, and upload it for their instructor to see. Finally, once they've collected all the numbers, students provide an SBAR report and are able to text the provider and receive a response. At the very end of the case study, they are asked some brief reflection questions on their performance, and then they complete the assignment. So once they click complete, a report is sent to their instructor. Let's take a look at how that looks. We are over in the instructor's email account now, and you can see the completed report that is sent once a student submits the assignment. Here you can see their name as well as the escape room scenario that they completed, and underneath are all of their recorded responses. Any chart that they completed as a PDF, the instructor can click and it will bring up a web page that includes their specific responses. All other recorded responses, such as select all that apply, any free text, the closed style questions, the matrix questions, all appear here, as well as any images that the student drew on as part of the assignment. So you can see this is very versatile as far as using it as a graded assignment, a makeup, clinical, or an in-class active learning tool. If you would like to learn more and see how you can use these innovative case studies to develop the clinical judgment needed for both next-gen and professional practice, please check out the link below.